This is Henderson County Sheriff Lowell Griffin coming to you once again. Today we want to talk about the importance of this stay-at-home order and the importance of social distancing. Now, please don't read anything into this. I still don't want anybody to panic. It looks like our grocery stores may be starting to recover. People can get the supplies that they need. Grocery stores, Walmart, drugstores, nothing else is shutting down. So don't read more into this. As a matter of fact, as we talk about social distancing, as we talk about the stay-at-home order, I really appreciate the majority of the residents of Henderson County understanding the gravity of the situation with what we're facing with the COVID-19. It's an extremely contagious virus, and that's the reason for these orders. We can't afford for everybody in Henderson County to get sick, especially to get sick at one time. There's still a few that I see that evidently don't understand, they don't realize how serious this is. And for those people, I want you to pay attention. I've got some numbers for you. Okay, now I may not be the greatest at math, so you can double check my figures, but I'm pretty sure these are close to right. So understand, here in Henderson County, we've got approximately 130,000 residents, okay? There may be more people in Henderson County during the day than that, but there's roughly 130,000 residents here. So, figures from the CDC and information that we're getting from our local health professionals tell us that those that get sick, of those that contract the COVID virus, that 80% won't need really medical intervention, that they will be able probably to self-treat just like you had the cold or the flu to get through this. So that sounds very positive, and it is positive, okay? But there's some other realistic figures we need to look at. If we chose not to stay at home, if we choose not to practice the social distancing, and everybody in Henderson County got sick at one time, this is kind of what it would look like. Out of 130,000 people, that 80% mark is 104,000. Okay, so that still leaves us quite a few people that would need medical intervention just for the COVID-19. Of that 20%, okay, 5% are expected to need hospitalization possibly, or even more intensive therapies. So if we didn't practice social distancing, if we don't stay at home, 5% of 130,000 is 6,500. Now we are, like I said, most of us are practicing the guidelines as we've been told to. So that helps us out a whole lot. But for those of you that continue not to, let's look at this with some realistic figures. Let's say we looked at this as a total population. Let's say out of this 5%, 1/10, let's pull this down to 1/10, okay? 1/10 of the figure, 6,500, that figure that I said would possibly need hospitalization or even more intensive treatment, comes out to 650. Now, why is that number so significant? Because in this region, our healthcare providers cannot take care of 650 folks that are hospitalized. In Henderson County, out of 2 hospitals, we have around 300 hospital beds. So that means if we don't practice the social distancing, if we don't stay at home, if this virus continues to spread, that there's a possibility, even at 1/10 of this number, 1/10, that there's going to be a lot of people that can't even get into the hospital and get treatment. We're going to overload our healthcare system. We can't afford to do that. So again, I urge you, don't panic. Grocery stores are still going to be open, but that doesn't mean just because it's a pretty weekend and everybody wants to get their plants, everybody wants to get their flowers, we want to get them planted, okay, we need to run to town, we're bored, and certain businesses are open to allow us to get those essentials that we need. But not everybody needs to flood our big box stores at one time. Let's use some common sense here. Let's survive this. Together we can do this. Okay, let's take care of each other. Let's take care of Henderson County. Thank you.